Welcome to our webinar on recovery and return to work in regional Queensland. We appreciate you taking your time out of your busy day to tune in. My name is Naomi and I will be one of your hosts for today. Before we begin today's session, I would like to make an acknowledgement of country. WorkCover Queensland acknowledges and pays respect to Queensland elders past, present and emerging. We thank the traditional custodians of country throughout Australia for their ongoing custodianship of land, waters and community. Today's session will run for approximately 45 minutes. We will have a Q&A session at the end. You can submit your questions throughout the session and we will do our best to get to them at the end. Your questions can be submitted by clicking on the question button on the right-hand side of your screen. If you are experiencing any technical issues, such as sound, there is a help button also on the right-hand side of your screen. This webinar will be recorded and it will be sent to you out early next week. Simone and I will be co-hosting this webinar. We are injury management graduates here at WorkCover Queensland, both with backgrounds in allied health. We have the privilege of having Dr. Sid O'Toole here today to provide us with some insight about how to facilitate return to work for workers based in regional areas. Dr. O'Toole is an occupational and environmental physician and is also part of our independent medical examination panel.
Here's what's on the agenda today. Firstly, we'll be going through injury statistics that are relevant to your specific region and industry and how to effectively facilitate return to work. Next, we'll be talking about WorkCover medical certificates, Provider Connect, and case conferencing. Following that, our guest speaker, Dr. Sid O'Toole, will give a presentation on recovery and return to work in regional Queensland from the perspective of an occupational physician. Up next, we'll be showing you what services we provide to make working with us as easy as possible. Finally, we'll be answering some of your questions that you may have for us and Dr. O'Toole. We'll endeavour to answer as many as we can, but if we don't get to you, you can send us an email and we'll aim to get back to you as soon as possible. We're very excited to have you all join us today. While we've hosted many webinars here at WorkCover Queensland, this is the first time we've tailored our messaging for our employers and providers in regional Queensland. We listened to your feedback and wanted to bring you all together to work out the best way to work cohesively within our ecosystem. That is us, the insurer, the worker, the employer, and the providers. Those of you invited today are from the Kingaroy, Kilcoy, and Dalby region. Our claims analysis revealed that these regions have the most interaction with us, and we wanted to address your concerns. This region includes the following industries: agriculture, forestry and fishing, manufacturing, retail trade, accommodation and food services, construction, transport, postal and warehousing, healthcare and social assistance, wholesale trade, administrative and support services, education, training, and other services.
We will begin by focusing on what the current industry trends are and what can be done by employers to facilitate return to work. We analysed 1,242 claims accepted within the past five financial years from the following industries in the Kingaroy, Kilcoy, and Dalby regions. This graph shows the average amount of total payments that have been made per claim per category. In some industries, the majority of claims cost is attributed to hospital or other payments. Other payments consist of medical expenses such as medication and independent living aids or services. This graphic represents the average time frame of a claim from the day of injury through to when the claim is closed. The numbers show the average amount of days between each phase. Wholesale trade shows an average claim is lodged almost a year after the injury occurring. Manufacturing and agriculture have an average claim lodgement delay of around 40 days. In some cases, delaying the commencement of treatment can extend recovery times for a worker and when they will have capacity to return to some form of work. It is important to generate good safety culture at work that does not have negative attitudes towards workers who take out workers' compensation claims. The injury data that we have presented comes from the claim information located in WorkCover Connect. You have the ability to look at the trends for your claims through the analytics function. The performance of your workplace can also be compared to how your industry is performing. You can also use it to easily lodge claims, declare wages, and view your premium. While it's only March, premium season is less than 4 months away. WorkCover Connect is a great tool to use to see how you are tracking with your premium by using the Premium Simulator. If you are unsure how to navigate the portal, we have many tutorials on our website that can step you through how to use each function of WorkCover Connect.
Research demonstrates that getting back to work after someone is injured is vital in supporting their health and well-being for their current and future state. Being off work for extended periods of time can negatively affect the way they think about their return to work process. Literature from the Royal Australasian College of Physicians show that the longer you stay off work, the less likely you are to ever return. If a worker is off for 20 days, there's a 70% chance of them ever returning to work. After 45 days, it drops down to a 50% chance, and 70 days or greater off work, there's only a 35% chance of ever returning to work. It follows that work is generally good for health and well-being, and that long-term work absence, work incapacity, and unemployment can have a negative effect on health and well-being. With this in mind, you might be wondering what you can do to help support workers in their return to work journey. If you need any assistance or have any questions, one of the best things to do is to contact us. Our role is to work together with providers, workers, and employers to obtain the best outcome for all parties. For employers, offering suitable or light duties in the workplace can be tremendously helpful in reintegrating the worker back in the workplace. We'll speak a bit more about this in the following slides. Additionally, keeping open communication with all parties, including doctors and other treating practitioners, can help keep everyone on track and focus towards a common goal. It's also beneficial to focus on what the worker can do and not what they can't do to help foster confidence in their recovery process. Suitable duties involve providing lighter or alternative duties in the workplace that does not risk aggravating an injury. Despite having an injury, we can look at our workers' skills and experience to find other ways that can positively contribute to a workplace. Having a worker on suitable duties benefits both parties. Workers can keep a routine, regain confidence in working, and might even develop new skills. Employers will have the effect on their premiums reduced. The level of skill or expertise in the workforce stays the same or is strengthened, and there's no need to retrain new staff. Our website has a list of job tasks for specific roles that can help you develop a suitable duties plan for your workers. If you're having trouble identifying suitable duties, an occupational therapist or a return to work coordinator can be organized to help identify them. If you're still having trouble finding and providing suitable duties within your workplace, we provide a service known as the Recover at Work program. This program sources an alternative host employer that your worker can be placed with to work temporarily while they recover from their injury. Naomi will be speaking a bit more about this later on, so stay tuned if you'd like to know more. Direct supervisors play a critical role in ensuring the success of the worker's return to work and rehabilitation journey. They promote a stay at work and recover at work culture and ensure that workers feel productive, supported, and valued. They're also responsible for ensuring regular and open communication within the organization and to all relevant parties. A recent study revealed that the most desired skills and traits that workers wanted from a supervisor during the return to work process were knowledge of the injury and how it affects capacity, relation of trust with the worker, social support, and a participative management style. So what does that look like? Here are a few things that make a supervisor a great supervisor when supporting a worker in the return to work process. A supervisor should always be proactive, communicate openly, listen to the worker's concerns, understand that the worker may still be unwell even if they have returned to work, have an open door policy, adapt their approach to their worker, allow the worker to maintain a level of certain normality, be quick to respond to the worker, take responsibility for the worker's rehabilitation process, acknowledge the impact of the worker's injury, and remain positive with the worker. In this part of the webinar, we'll be focusing on services we have for providers. A WorkCover medical certificate is one of the most important tools that we use to keep everyone involved in the claim informed about the work-related injury. While it may seem like it's just a form of documentation, it's actually a communication tool. It helps everyone know what the injury is, what treatment is required, if suitable duties are required, and what the expected timeframes are. It is vital that these certificates are filled out correctly so that everyone is accurately informed about where the worker is in their return to work journey and how they may progress, so that everyone can make plans in a timely manner. One thing that I would like to clarify is that we are unable to accept pain as a diagnosis. However, if there is an underlying condition that is contributing to the pain, the condition can be accepted as a diagnosis. For ongoing claims, we require a work capacity medical certificate rather than a regular medical certificate. If you need assistance on how to fill these out, we have a full guideline on our website.
Provider Connect is an online portal designed for our network of medical and allied health providers and other providers who do business with us. We had a look at the activity of providers within this region, and unfortunately, only 5% of active providers have utilised this free tool. Using Provider Connect will allow for you to receive payments within a 48-hour timeframe compared to 7 to 10 business days if lodging invoices with paper or PDF. The portal lets you do your billing online, view invoices and remittances, check for a billing status, and more. You can even save yourself a phone call to us to check whether a claim has been accepted or to change your bank details, as these can be done online. If you're not sure how to use the portal, you can find many tutorials on our website that will guide you how to do so and how to use each function in Provider Connect. Just to remind all of our providers, you can bill us for the time that you take to talk to us. We appreciate your time taken to ensure workers are on the best possible path to return to work. For a complete list of our item codes, please refer to our table of costs relevant to the services that you provide. One of the challenges that we find with supporting return to work in regional areas is accessibility. Even though we are based in Brisbane, we have made it a business priority to engage with our stakeholders in regional areas. One method of making sure we are connected with our workers in regional areas is by using case conferencing. This involves setting up a meeting with all of the relevant parties involved in the claim, which can include the worker, providers, and their employer. It can be done face-to-face, over the phone, or through video conferencing, such as Skype, Zoom, or Teams. It can be proposed by anyone involved in the worker's return to work if they feel the need for multiple people to discuss the worker's progress. Once again, these types of meetings can be billed using our item codes for case conferencing. There are many benefits of gathering together to discuss a worker's return to work. It can be time efficient when it comes to delivering information, sharing ideas, and making decisions or plans. It also acknowledges the work of everyone involved and gives the worker a say in their return to work journey. With that being said, we know that collaboration can be a key driver for positive return to work outcomes. I would now like to invite Dr. Sid O'Toole to go through some of the return to work barriers regional areas face, as well as how we can overcome them.
Beautiful. Thank you very much, Naomi, and Workcover Queensland for the opportunity to come and have a chat today. So my name's Sid O'Toole. I'm an occupational environmental physician. So that's a specialist doctor that works at the interface between work and health. And today I'm just going to reflect on a couple of the things that I identify when I travel extensively around rural and regional Queensland that I see as barriers that we can work towards overcoming to try and get better outcomes in return to work for all affected. So what do we see in regional Queensland? Well, objectively, and you've already seen some of the stats that were put up a little bit earlier, we see that there are higher rates of manufacture and process industry work being performed. We don't tend to see big farms, we don't tend to see big factories and big meat processing facilities in the centre of Brisbane, and so therefore they're in those more regional areas. And with that comes specific risk. Performing manual tasks, there is an inherent risk within that of creating injury and illness. But regardless of the fact that there is an increased risk, the spectrum of injuries that we see is still the same. Predominantly, we see that approximately 80% all injuries are musculoskeletal in nature, and predominantly they affect the shoulder, the back, and the hand. So whilst the pattern of injuries is still the same, the difference is the outcome from those injuries. And one of the things that I see repeatedly and is a significant point of frustration is actually there's repeatedly a delay in the start of the claim being lodged and the treatment that is required being formulated. And the reasons for that are multifactorial, and we'll get onto that in a second. But it is a significant barrier that we need to really overcome so that we can get a nice streamlined outcome for all involved, the injured worker, the employer, and also WorkCover Queensland. One of the downsides personally for me that I see, I'm a country boy, I'm from a town of 3,000 people, so I understand the communities very much. And so when I see that there's less successful outcomes in injured workers in rural and regional areas, that really strikes a chord with me. And it's something that I really want to work actively to address, hence why I'm here today. The things that we see is often there is an incomplete resolution of what would normally be seen as a nice, simple, straightforward condition. And that's multifactorial, and there's individual factors, there's systemic factors, and there's also treatment factors that are surrounding this issue. One of the other things that I often see is one of my roles is to perform impairment assessments on individuals after they've suffered an injury and illness and been deemed to be stable and stationary. And in general, I'm seeing a significantly higher level of impairment in rural and regional areas in injured workers for the same conditions when you compare them to people that have access to more facilities and more intervention at that earlier stage. So I guess before we can try and come up with a solution, we have to actually identify what the barriers are. And so I've split this into a few key areas. And the first one is the delay in accessing treatment. One of the things that both causes me concern, but is also a small amount of pride in me, is seeing the level of stoicism that we see in regional areas that you just don't see in the cities. There are a general belief that you have to get on with the job. The work needs to be done. We've got to keep going, and it's just a niggle, so I won't do anything about it and I won't report it. And when you do that, that means that by the time you get to the stage where you have to get treatment, you have to get intervention, you generally have to have more significant intervention and treatment because you've been sort of allowing something to grumble away and significantly worsen over time. One of the other things that I repeatedly hear from injured workers is that they don't want to upset their employer. And again, that's for many different reasons. It could be that their employer is actually a friend or a relative. If it's a small environment, if it's a small population, then everyone knows everyone. I know that when I was growing up as a child, I literally couldn't fart at home without the bus driver taking me to school knowing that I had done it. Everyone talks, everyone knows each other. And often we hear that there's this fear regarding WorkCover that they don't want to be seen as that guy. They don't want to be seen as the person that's on WorkCover and the flow-on effects that can have to their employer. Sometimes we see employers apply pressure back down to say to someone, look, don't worry about WorkCover, we'll take care of it, we'll cover the costs, etc. So because they don't want a claim against them, they don't want it to affect their premium. And I guess all in all, there's this underlying level of fear that if you have an injury, the worker's going to end up losing their job. And again, the reasons for that are varied, or the reasons for that belief are varied. It could be that they fear that they're unable to get another job, particularly if it's in a small environment where they don't have a large number of employers, and they will try and lock onto that job. And it is actually a phenomenon that we recognise around the world called job lock, particularly when we talk about people involved in insurance systems. I guess the greatest barrier that I see is the tyranny of distance creates a limit in resources. And that's because we have such a dispersed population, and so proximity to a care provider is limited when you get into regional areas. I spoke earlier of being from a regional area myself, but I'm a dirty Mexican. I come from Victoria, so proximity for us is difficult. But when you consider it's the same distance from Brisbane to Melbourne as it is from Brisbane to Cairns, that's a bigger problem in Queensland. We've got such a greater area that people can be spread across, that getting them closer to a GP, getting them closer to an allied health provider to get their treatment is very, very difficult. And I think one of the, if we can say, the silver linings to the COVID cloud is that we've had a greater understanding and acceptance of using alternate methods such as telehealth to be able to maintain that connectivity. And one of the organisations that was the first to actually put that in place around Australia was actually WorkCover Queensland, to allow that dedicated focus point, that ability to communicate and keep people on the right track to where they needed to be. In addition to that, though, there's an issue with availability. When you have a small community and there is only one, maybe two GPs in that small community, having the availability to be able to have an appointment very quickly to be able to address a work-related injury is often very difficult. I know rural and regional GPs work ridiculously long hours, just taking care of all of the other problems that people have in their lives. And when we consider that workers' compensation or injury management from a work-related injury make up less than 5% of a GP's workload, that is obviously going to fall down in the priority list when they've got complicated diabetes cases, complicated heart disease cases that they really need to monitor. So getting an appointment in rapid time and in an appropriate time to be able to bring about a significant outcome is often very, very difficult. In addition to that, there's also a lack generally of availability to the allied health provider. GPs are very good at being able to pick up a problem, come up with a course of management for it. But if someone needs 6 physiotherapy sessions to help with their sore shoulder, if there's only one physiotherapist and that physiotherapist is actually not in that town, but in 2 towns over, and that's a 45-minute drive to get there, and then they've actually got 7 towns around them that are trying to do the same thing. Again, that availability to get in and be seen and treated is quite limited. In addition to that, we use physiotherapists a lot. Physiotherapists work in musculoskeletal management, but there's also a role for other allied health providers, and particularly exercise physiologists, which are very good at return to work and getting people back to normal living after they've suffered an injury. But they're few and far between, and they're extremely hard to find out in rural and regional areas. So that lack of expertise is leading to delays in recovery. Occupational therapists are also a very specialised allied health group, and their role in returning people to work, returning people to normal living, understanding how they can use different manual handling equipment, etc., to assist someone that goes beyond the scope and understanding of an exercise physiologist or a physiotherapist means that their role is key. But again, if you only have a town of 2,000 people, the need for one is probably not enough for you to have one full time. So the communities have to band together and share the resources, much like I spoke about with the physiotherapist. One of the other issues is with medical and allied health providers, we tend to have difficulty getting people to go to regional and rural areas. And whilst those barriers are, again, multifactorial, I was fortunate enough when I was at university to be part of some pilot programs and the John Flint scholarships, etc. And one of the things we identified back then when I was at uni, years ago, was that it's not so much trying to just get a professional, allied health professional, a GP out to those areas. You also have to consider whether their partner has capability for working. And generally, allied health professionals and medical people tend to also marry and have partners who are also professional people. And so if someone can't get a job for their partner, they're less likely to be able to go out. And obviously with limited resources and limited industry in some of those areas, that's very, very difficult. And I have to admit that was, as I said, years ago, and nothing has changed in that time. And the Band-Aid approach has been to then use the DWS system, where we send overseas trained doctors out into that environment, and that has a limited effect. But if they're there for a short period of time, there's no way that doctor's going to be able to get an understanding of your business, get an understanding of what happens and the specific risks, because by the time they could possibly do that, they've then gone to the next location. And I guess that flows into knowledge. And this is in no way, shape or form a dig or derogatory comment about the skills of the allied health providers and medical providers in regional and rural areas. But when your work is focused on 95% not injury management and return to work, your focus on your continuing professional development will be on areas outside of injury management and return to work. So I'm a consultant physician, and I can't tell you the best medication to manage complex high blood pressure, but a GP can. My area of knowledge is the best treatment for injury management and causation, what actually causes an injury. So I focus on that, and that's why occupational environmental physicians are very good at that, whereas a GP just doesn't have the time to be able to focus on those areas. So often they rely on things that they've learned in med school, and things have changed significantly over that time. Tennis elbow, nothing to do with tennis. It's not even an inflammatory condition. And when I went through med school, it was an inflammatory condition that was caused by repetitive use. Whereas now we've actually seen the evidence shows it's not even related to that. And so as time progresses, that knowledge base has to then filter down. Unfortunately, in medicine, the evidence shows that once we get a new understanding of what causes a condition, it takes on average 17 years for that to trickle down for the majority of practitioners to have that as a common knowledge. And that's terrible. But unfortunately, it's just the case, and there's only so much education and training that we can do. Another key barrier that we've identified is the complicated relationship. There's a multi-pronged relationship when you're a medical provider taking care of an injured worker. You've got not just the injured worker that's sitting in front of you, but you've also got the insurer and the employer that you have to deal with. In Occupational, we often say that managing injured workers is much like managing pediatrics. There's no children involved, but in pediatrics, you're trying to take care of the child and often two parents at the same time. In injury management, we're trying to take care of an injured worker and the other bodies that are involved, being the insurer and the employer. And when your injury is being managed by your own GP, there are both pros and cons to that. The GP obviously knows you very well. They have an understanding of your other medical concerns that could impact your return to work and your recovery. But there's also the con that if in a small community, the GP might also be the GP of the person's boss. The GP might not understand the relationship between you and that boss. They might think that the relationship is sour when it's not, or vice versa. And they may not have the understanding of the specific risks in that job because they've assumed that it's the same as what it was 10 years ago when they first got into that town. There's always some contention between a workplace and WorkCover Queensland at some point in time. And again, that comes from lack of communication. There's often turnovers in WorkCover Queensland's representative for your organisation, and sometimes a negative outcome can lead to a poor relationship, and that leads to failure to lodge. It leads to a lack of trust. And when there's a lack of trust, then there's a lesser likelihood that you will want to engage with WorkCover Queensland. And if there's a lack of trust between the employer and the GP, the employer might actually think that the GP, for want of a better term, is being soft and giving people lots of time off that they don't need or that they can't see that they need. And that creates a breakdown in that relationship. The irony of it all is when we have good trust and good relationships between those three people in the prong, then we actually get a better outcome, because we're then actively working against all of those barriers that I've spoken about so far. And the key to getting a good outcome is rapid assessment, and correct treatment. If you have a good relationship between all of those key providers, then WorkCover will be able to help you to facilitate getting the right investigations, the right treatment, and the right outcomes. They have the ability to be able to fund moving people around, taking them to the facilities that they need to get to, that aren't just down the road like they are if you were in Brisbane. And that, as I identified, is a key to getting a good outcome. If there are questions, if you're not convinced that this particular injury happened in the workplace, as an employer, you can actually ask. You can say, I'm not convinced this happened. As a doctor, if you're not convinced that there is a 100% relationship between the work-related event and the injury, or you're concerned that there are other factors, you can ask. Then WorkCover Queensland will refer it on to someone else for another opinion to help you with the management of this condition. So in addition to IME panels, there's the medical assessment panel, where specialists like myself will be asked, does this match up? And if so, what is the best course of treatment? So then everyone can feel comfortable moving forward that the person is going to be on the right track and actually getting the outcomes that are beneficial, not just to the injured worker, but everyone that's involved in the system. So having said all of that, what am I? What's an occupational environmental physician, and why do we get involved in this situation? Well, we often think of ourselves as the babblefish of workplace health. We sit in the middle, and in that spoke and hub, I guess we're the axle. We look down and are able to see all of the different points of view because we speak the language of medicine, we speak the language of workplace and industrial relations, and we speak the language of insurance. And the way that we're able to do that is because we are specialists in causation. Every man and their dog will have seen of or heard of a pre-employment medical. We're the people who design those. And how we design those is because we have an understanding of the risks in a workplace. We're constantly out on workplaces. It's not just something we like to do, it's part of our job. So we can see the inherent risks within a role, and we know that specific roles and hazards will cause injury, and we manage them by the hierarchy of controls. We try and prevent it first and foremost. But we also know what the difference is between something that's happened at work, something that has been occurring 100% outside of work, but is just getting worse over time, and therefore activities in the workplace are causing discomfort. And we can tell what's a bit of a blend in the middle, what we call an exacerbation or an aggravation. And we're here to actually help. Our role, sometimes we get seen as being the naysayer, says this is definitely not work related, and this is definitely work related, or it's that bit in the middle. So we're going to upset someone at some stage, but it's very important that we make those delineations, and it's got nothing to do with premiums, it's got nothing to do with the insurer. It's actually to do with the patient themselves, because we know that when an individual suffers an injury that is work related, they're already more likely to have a bad outcome than if they suffered that injury in their own home or out in the community. And so we don't want to send people down a rabbit warren where we know they're going to get a bad outcome, because it's unethical to do that. And then once we've identified what's work related, what's not, we talk about evidence-based treatment. You know, we talk what actually works. How much physio does someone need before they're no longer getting benefit that's going to change the outcome? But you know, they might be getting physio and loving physio, and they're up to their 50th episode of physio because everyone feels a little bit better after they get a back rub. I know I feel a little better on the 4 occasions a century I get a back rub, and that's got to be differentiated from what's actually going to change the underlying pathology. And so that's where we become involved in the evidence-based treatment. I guess the classic example is we know that over 50% of knee arthroscopes that are performed in this country every year are unnecessary. They do not change the outcome. They do not slow someone needing to go and get a knee replacement in 20 years' time. We also know that subacromial decompression of the shoulder has no proven benefit over physiotherapy over the course of a 12-month period. And yet it's still one of the most commonly performed procedures in the country. So our role here is to prevent harm. We don't want people to go down a pathway of treatment that's not going to benefit them, and at worst is actually going to make them have a negative outcome. We often see post-surgery that people are loss in range of motion, loss in function, that is worse than before they had that. And don't get me wrong, I'm not anti-surgery at all. I've had all of the different procedures that I just listed there. But we need to make sure that if we want to get someone back to normal living, that we treat them with evidence-based treatment. And I guess, unfortunately nowadays, normal living is work. Work makes up, in some people's lives, like mine, about 50 to 60% of normal living. In other people's, it's usually a third. So that's a significant portion of their life that we want to get them back to. And I guess the key messages out of all of this today and my extended ramblings is we need to all work together to get the best outcome. We need to have that development of trust between the doctor and the patient, the doctor and the workplace and the patient, the workplace and the insurer, the patient and the insurer, and the doctor and the insurer. And because there are many different languages that are trying to be spoken at once, sometimes it's worth actually sticking your hand up and asking for help. And your first port of call to ask for help is obviously to call WorkCover Queensland with all those facilities that were listed earlier. And sometimes it's worth giving someone like me a call where we can actually help guide and act as that battlefish in the middle that can communicate with all of the levels. That's about all I got. I'll move on. Thanks. That's where to find me.
Thanks, Dr. O'Toole, for providing your insights and experiences as an occupational and environmental physician and about managing and treating patients in regional Queensland. If you have any questions for Dr. O'Toole, please hang on tight as we'll have a short Q&A session at the end. We're now going to take some time to speak about the services we provide. We have in-house case managers that only manage claims for your specific industry. They're also available for site visits to get to know your business and its operations a bit better. Our free app, Worker Assist, is available for workers to support them throughout their claim. The app can provide real-time information 24/7. We encourage you and your workers to use the Worker Assist app to help stay connected with us. It makes it easy for workers to track their injury claim without having to call us. They can message us through the app if they're not able to call us during business hours, making it great for shift workers or those who are time poor. It's easy to upload medical certificates and receipts. Simply take a photo through your smartphone and upload it through the app. They can also set up appointment reminders to keep track of their medical appointments. Adjustment to injury counselling is a service for workers who need some support adjusting to their injury or are having difficulty coping. It gives them access to a psychologist or counsellor to help support them and their injury in the early stages, irrespective of whether the claim is accepted. We can refer workers onto the service without needing a referral from a doctor, and the worker has their own choice of provider. What this means is that we can give support when they need it most. Research shows that early intervention is key for ensuring that the worker has the best chance of recovery and return to work.
As Simone alluded to earlier, we have the ability to provide host placement. Sometimes suitable duties aren't always available for workers at their usual place of employment, especially in industries that predominantly involve physical labour. If this is the case, workers are able to engage with host employment. Our Recover at Work program places workers in short-term host employment with employers who are known to have successful return to work outcomes. The program usually runs for 3 to 6 weeks. WorkCover pays for the workers' wages and when they participate in a suitable duties program, and the host employer benefits from the services of an additional skilled worker. At the end of the placement, there is no obligation to employ. Alternatively, if you are interested in becoming a host employer, please get in contact with us and we can step you through the process. We have had many success stories from the Recover at Work program. One example includes Kylie Easton, who was one of our Recover at Work participants based in Lend-Lease. She was able to complete host placements since she could not complete suitable duties at her original workplace. She ultimately went on to gain employment at Host when a position became available. In some cases, workers find themselves in the position where their injury prevents them from returning to their original role or place of employment. In these circumstances, our Employment Connect program can assist with obtaining a positive return to work outcome. The Employment Connect program is a new program we have introduced to help workers increase their employability now and into the future. We can provide assistance to workers in the form of consultants specialising in return to work, funding for courses to support upskilling, and job preparation and placement help. We encourage you to let your workers know about this service as we endeavour to support them beyond their injury recovery period. One of our services that we have for employers is the Injury Prevention and Management Program. This program is directed at employers to provide advice and support on workplace health and safety. If you sign up for the program, you will be allocated to a dedicated advisor who will take the time out to understand your individual business needs. They will work with you and assist you with creating a tailored business improvement plan based on the assessment of your existing systems. If you'd like to learn more, you can find more information on our website. We are always continually improving our current services to provide the best support to our customers.
Okay, thank you everyone for your attention. We have a bit of time now to address some of the questions that were brought up during the webinar. There's still a bit of time to submit, so while you all finalize any questions you might have, we're going to take a small break to look at the questions. We're going to review the questions submitted, and so we'll go on mute for a few minutes and we'll be back at 10:23. Thanks everyone for your patience. We're back and we'll go through some of the questions that were submitted from our audience. So the first question is from one of our employers. And the question is, you talked about how some people don't want to be that guy on workers' comp. What can we do to ensure that workers don't feel ashamed to engage with work cover?
Yeah, look, I think that's actually a really good question. And as I said, something that we see quite commonly. I guess it's very difficult to try and overcome an individual person's feeling of shame and how they perceive themselves in the world. So you have to target the entire workforce in the hope that by having that consistency of message, that it will trickle down through the entire workforce. So you need to be supportive. You need to show to your workers that you are supportive of a process, that if someone does get injured, that you will get them back to work, that you will maintain their connectivity with the workplace. One of the areas that I didn't quite touch on with the role between the injured worker and the employer is continuity of contact. You need to keep the person involved. They need to feel like they belong. Part of the reason why people don't want to be that guy is because they fear that they'll be shunned by the workplace. So if you have previous examples where you've done it really well, highlighting that to the entire workforce, saying, Bluey was on work cover. These are all the things we did for Bluey because Bluey is a key member of our workforce. We want Bluey to get back. I guess the other thing that's really important is don't just highlight your successes. Actually say, we have looked at what we have done in the past and we could have done it better. And so, when Fran was crook, we let her go off and we never kept contact with her. And that was a failing on both sides. And this is what we've now put in place to make sure that that doesn't happen again. Because every single person who works here is important to us. And look, I totally acknowledge sometimes that's very difficult to do with some people who work for you. We all have people who work for us who are brilliant, and we have people who work for us that, having conversations with them is like fingernails down a chalkboard. Sometimes you've just got to step above that, and you've got to accept that this is a person in a particular situation and still do everything that you can to make that person feel like they belong and that their concerns are your concerns. Sometimes that involves a little bit of, Oscar-worthy performance, but it's still worth it in the end because it's for the greater good. It's not just for that one individual, it's for everyone. Because when people feel like they belong and feel like they're going to be supported if they do suffer an injury, then they're less likely to feel like they're going to be that guy that's working in your system.
Well, thank you so much for that answer. We have time for one more question for you, Dr. O'Toole. This one's from an employer as well. And they ask, in your experience as an occupational and environmental physician, what are some of the common traits that lead to a positive return to work outcome?
Look, again, a good question. I guess it's the ideal sort of question to ask someone like me. At the end of the day, the most important thing is the diagnosis is correct. You've got to make sure that you are managing the actual problem. I used the shoulder as the example earlier. The shoulder is a very, very complex joint. It's the only joint that can actually move through 180 degrees in two different planes. So there are so many different structures within that could potentially go wrong. But if you send someone for an ultrasound and it shows there's bursitis in there, or it's labeled as bursitis, you start treating it and you get so focused down that you can't consider that maybe one of the other structures in the shoulder is affected, or even the neck, which often causes problems in the shoulder when it's actually from the neck origin, then you're taking the person down a pathway where they're never going to get a successful outcome. So early diagnosis, correct diagnosis, getting on top of things early and encouraging people to stay active. When claims and when injured workers, their case sort of starts to drag and drag and drag, as we saw from your stats earlier, the longer someone's injured, the less likely they are to get back to work. One of the issues we find is when people are told, look, just go and rest, they reduce all of their activity. So they don't do the housework anymore. They don't do their sports and activities that they used to enjoy, when what they should be doing is still doing those things, but in a modified way, because we don't want the rest of the body to decondition. If you immobilize someone for 3 weeks, they will lose 5% of their muscle mass. That's a huge amount. So early intervention, correct diagnosis, treating the right thing, keeping the person active, and I guess last but not least, if you're not sure, ask for help. There are so many services available to help, not just you as the worker, or you as the care provider, or you as the employer, but ones that actually sit in the middle, which we've all heard about today, that can actually help all at once. And that coordinated approach is what's going to get the best outcome for everyone.
Great, thank you so much. That's all the time we have for questions. Thank you so much for your time, Dr. O'Toole.
Yeah, it's been a pleasure, thanks.
Thanks to everyone for joining us today. It was a really great opportunity to have those of you join from Regional Queensland in our first, but definitely not last presentation tailored for you. Our takeaway messages from today are: do your best to support your workers when they have an injury. Your support makes an immense difference in their recovery and return to work process. We at WorkCover Queensland are here to help and work with you. Any questions you might have, please don't hesitate to pick up the phone and get in contact with us. Although the return to work process can have its challenges, we have all the right tools and resources to help you overcome them. We want to make all of our customers, whether you're an employer, provider, or worker, feel valued through our connected ecosystem. Remember that this webinar is recorded and will be sent around to the email addresses that you registered with early last week. This slide contains all the links that we referenced throughout the presentation. If you have any other questions, please send them through to the email address located at the end of this slide pack. And last but certainly not least, we would especially like to thank our guest speaker, Dr. Sid O'Toole, for featuring as our guest speaker today. Working with you is always a pleasure, and we know that our customers will have a great experience working with you too. Once again, on behalf of all of us from WorkCover Queensland, thank you for joining us, and we hope to speak to you soon.